most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Because we're the most famous physical therapists on the internet.
In our opinion, of
and
course,
I can
Bob.
speak. Today we're going to talk about home self cervical traction, 2 best options. You're almost going to show 3 best options, Brad.
Well, that's a good point, but they'll have to see. It really 2 categories.
2 main ones.
You're right. Mm-hmm.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. What day is this going up, Mike? Sunday night. So we're giving away, go to bobandbrad.com, go to the giveaway section. We're giving away a Booyah Stick.
Booyah!
Yeah, booyah, booyah. You get to say booyah when you buy one. And if you win one, you can also go to Facebook and it'll be pinned to the top of the page, the contest that is.
Sure.
Go to Twitter, Instagram, or TikTok, and you will find a 60-second version of our program each day.
All right, Bob. Self-cervical traction. Sometimes it's known as decompression.
Or neck traction. People don't know what cervical is.
Exactly. The reason it's done mostly is if you have neck pain or you have a pinched nerve in your neck and you'll have pain, numbness, tingling into the shoulder and down into the arm, all the way to the hand possibly.
Yeah, it could be radiculopathy as we call it.
Exactly. And this can be a real effective way to treat that as well. So what we want to...
Should we show it on
Yeah,
there?
maybe we should. Let me get my glasses on, Bob, so I can see what's going on.
This guy, he's got a severed cord.
Whoa.
Did you know that?
Yeah, that's a problem. I don't think too much traction, perhaps. So here we've got the neck. Here, this would be the back of the spine. So like this, would be looking that direction. If you look right, can you zoom in on this, Mike?
So the first 7 bones make up the cervical spine or the neck.
And if you look at it, there's a fair amount of motion that goes on between each vertebra. I mean, it's not like a joint, like an elbow joint, but they call them facet joints. So there's 7 on this side, 7 on this side, and they slide against each other with rotation, as well as when you look forward. And then these yellow little look like spaghetti coming out. Those are your nerves, and those nerves actually go down and into your arm.
Yeah, they're
shoulder.
cut off here. They actually extend into your extremities.
So when I mentioned before about if you have a pinched nerve and the traction can help it, what's happening is the nerve here is being pinched, and it could be from a disc bulging, it could be from stenosis or some bone spurs, but or arthritis can...
Yeah, that hole that the nerve is coming out, foramen, it actually can be narrowed because of arthritis, so that's where the traction can help too.
Right, so when you pull, it actually opens things up. I don't know if we can see that.
I'll bet you if you go this angle, you can see that.
The movement is subtle. If we look here, and...
I see it right there, there.
And on your neck, it is pretty darn subtle.
Yeah, it is subtle.
You're not going to come out 2 inches taller because of this by any means. But that's the whole concept. And when it works right now. You don't do traction unless you have obvious improvement. If traction hurts or creates pain, you stop right now and you're done with it. It's got to be very clear.
Are you going to show the test, Brad, first that you might do on a patient?
Well, that's a good point, Bob.
I think you should.
Yep. Bob, why don't you pretend to be the patient?
Sure. How about if I sit? You want to do the one where you just pull up? Yeah,
right.
Okay, that's
exactly.
the one you're going to do?
You know, why don't you sit in...
Yeah, I was going to say, it might be
it's a lot easier for me, too.
Are you okay, Mike, if I come over here?
We might as well show this house is done in the clinic. So if someone's complaining of neck pain and maybe down into the arm, one of the things I will do is I'll have the patient sit up nice and tall.
Good posture.
There we go. Good posture first. I'm going to take my hand right here and gently push down. And I'm going to ask, is there any change in your neck pain?
It's making it worse.
It's making it worse. So compression makes it worse. Now, I'm not going to bear down on it. I'm just using some gentle pressure. And then I'm going to take my hand and go like this, and this hand and go like this. And I'm not going to choke, Bob.
But thinking about it.
Yeah, thinking about it. I'm going to go under the jaw here, so I'm on the mandible, the jawbone, and on the back on the occiput. And I'm just going to go gentle pressure straight up.
How about if I show it from this side?
Yeah, that's a good point. Get the profile. There we go. My hands are cold, Bob.
Yeah, I know that already.
Yeah, but I don't care. Not with you. It's okay. In the clinic, I wash with warm water. You go here here, and I'm going to go straight up, but not a lot of pressure. Gentle, and then I'm going to say, does that change anything? Does it make it better or worse? Better or worse?
Better.
Oh, okay. I didn't know if
Get thumbs up.
I didn't know if thumbs up meant worse pain. You know what I mean? So you have to be clear.
Sure.
You know, and this is something obviously you can't do to yourself.
Yeah, and you were probably putting what, 10, 20 pounds of pressure
At the
maybe?
yeah,
So,
I would between 10 and 15.
Sure.
Somewhere in there. And if there isn't someone to help, then the option is use a towel roll, and that's what we're going to get to next. If this works, then we go to the next section anyways, the next step,
Sure.
which is
the towel. Do you want to do it in the chair?
yeah,
Sure.
let's do it. So here we've got a towel roll, the red tape, you know, it's just some red
Just
duct
to
tape.
hold it in place.
Yeah, just so it doesn't fall apart. And this you can do by yourself. The only limitation particularly is the strength of your arms, and then they also fatigue. So you'll get good posture. You're going to go around. I'm going to mess with my mic a little bit here, so you might hear some noises here. And
So he's hooked underneath, again, the occiput as we
Yeah.
call it, and he's going to pull straight up.
yeah,
Now what you can do, if, let's say you're having pain down your right arm, you could put both ends of the towel together and pull up with just one. And that's often feels better because the right arm is irritated already, the nerve.
right.
So this is a way to do it without further irritating it.
Can you hear me, Mike? It's like my mic is in my nose. Yeah, don't wear your mic when you do this at home.
Right.
So again, you're going to be limited by, as long as it feels good, it takes pressure off, it makes the pain feel better, particularly if it makes your arm feel better. You know your goal. You want to continue to do this, but you're limited, again, by your arms getting tired, or especially
And you
one
can
arm.
even do repetitions.
Yep.
You can pull and then relax,
Yep.
pull and then relax. You can do it throughout the day. This is something you could have the towel nearby you when you're at your chair.
Sure.
And you can do it every hour. And sometimes it gets you through the day that way. And sometimes the neck improves overall because you're stretching some things
Right.
out that maybe
Right.
won't put as much pressure on the nerve anymore.
And also likely posture is a very big component of this, and this actually helps you promote good posture.
Now we do have a more expensive version.
Well,
right,
I've got
Brad?
another one.
Oh, you do?
Yep, if you have someone at home, and I've done this many times with
Oh,
patients.
sure.
as
We're
if-
going to have Mike come out for this, aren't we?
Yeah. So Mike is going to be our patient because he doesn't, we're
Yeah,
not going
he
to give him
doesn't-
any.
We're not going to put any microphone on
Right.
Mike. So, so
Mike's our cameraman.
Mike's our camera, and he's also part of the Bob and Brad crew.
There you go.
And check out their videos. He's pretty funny. He thinks he's funny anyway. So, yeah, so
So it's a
thanks,
sta-
Mike. The man in black.
All right. So Mike, why don't you lay down now? If Mike already knows that
If you lie down, Brad.
lie down, I'm sorry, he's done the traction and it helps, but it's like he can't hold it long enough. If he could hold it for a couple, 3 minutes, but wow, would that make things better? Then he's going to get somebody at home, and I've done this many times with either the spouse or a family member that has, good judgment, adult person. You take the towel roll underneath the head here, and usually just above the ears, and then put
Not
the
above
towel
the ears, below the ears.
below the ears. I'm
Yeah.
sorry, I'm looking upside down.
Sure.
And you have to communicate with the person. Okay, Mike, I'm just going to pull gently. As if it feels good, you have to let me know. How's that feel? Good. No
So
pain.
how much pressure, Brad, are you putting on?
I'm just leaning into it gently. This is nothing that you're going to.
Yeah, you really want to start off
Right.
very slow on
If
this.
you're a large person, muscular, and you're doing a smaller person, really any size, it's not like you're maxing out by any means. It's
Right.
gentle. And the person, Mike would say, it's starting to hurt. The arm, especially if the arm's getting worse, you got to stop right away. Only continue if it feels better.
Yeah, I often have my patients signal with their finger. I say, raise the one finger
Yeah.
if it hurts,
Yeah,
and we'll stop.
Sure.
So, if they get to the point where it hurts, raise the finger.
sure.
And not the middle finger, just the a finger.
Why don't you just have them talk?
Well, because sometimes, well, I guess I'm thinking about two when I got my
Right, I
hand.
know what you mean.
Yeah, well, I got my,
There's one where you go
yeah, we go
manually,
like
and
this.
then you're holding their jaw shut.
Yeah, and they can't talk.
But we're not showing that one. That's kind of more for therapists.
So,
Okay. And typically, when I do this, I'll hold it as long as it feels good. And they're saying, boy, it feels good. Just keep doing it. I'll hold it till I get tired. And that's usually a couple, 3 minutes. And then you go, oh, I need to take a break. My back's a little tired. My arms are tired.
sure.
And you'll do that a couple times. And then if you can do that throughout the day. Now, if this is all working good and your helper is getting tired or they're not around enough, there is an option. And I've had patients use this, and that's cervical traction unit you can buy, and you can do this completely by yourself once you learn how to use
It's a
it.
nice unit.
It is. This is the Saunders cervical traction. It's a little spendy, but if it keeps you from having a surgery on your neck,
Right.
it's well worth the money. Obviously, about $300 to $400 last time I had looked. Mike, can you scoot down a little bit?
By the way, if you pop Mike's head off, you can just put it right back on, right?
Oh yeah,
Yeah.
yeah. All right.
But it's interesting, Brad, that I actually worked at Saunders Clinic when I was going through school.
In the Twin Cities
in
area.
the Twin Cities
Yep.
area. Dwayne Saunders invented this, the whole traction genre, and he had a clinic at that time, and so I worked there for it was about 3 months.
Yeah,
So
he was. Is he still alive?
he's still alive.
Yeah.
He's retired.
You want to lay down, Mike? He's a physical therapist as well, so he's
Physical therapist.
yeah.
He's kind of like you, Brad. He was a big inventor. He was very good with mechanical things. No, like Brad. Not like you, Mike.
You won't be able to hear Mike without
Yeah.
the mic on. So you adjust this so it's comfortable on the occiput there. This gently goes over the head.
This is something you can do yourself. I
yep.
mean, you can set yourself up rather easy, to be honest with you.
There's a pneumatic cylinder, a little pressure cylinder that you control with this pump right here. It says pump here. We've got another video that goes called Saunders Traction, or Bob and Brad cervical traction. Now, Mike, you're going to tell me when there's some pressure on this and you feel like your neck is becoming pulled.
See, Brad's pumping right now,
Yep.
and that's causing the traction to occur.
So this is moving that way. His shoulders are being stabilized by this pad down here.
And again, normally Mike would do this,
Yeah. I'm just doing it now just to demonstrate.
facilitate.
The gives you an indication of how much pressure. So right now we're at 13 pounds. Now, if Mike is feeling like, oh, this feels good, we're going to keep it going. We may, and I usually have the patient do it. Mike, you want to pump that, but only if it feels good. When it feels like it's enough pressure, then you stop. If it creates pain in any manner or makes anything worse, you stop immediately. You do not continue whatsoever. How you doing, Mike? Okay, so then what I'll do the first day with a person, I'll have them on this traction. I'll note how many pounds are on there, Mike? 15. I'll write down 15 pounds. I'll hit a timer, and then I'll go for 5 minutes as long as it continues to feel good. Once the 5 minutes is done, we take the pressure off. We stand up, move around, move
And
the
how's
neck.
the pressure taken off, Brad? There's a little twist on the dial, isn't
Yep,
there?
right there. Good point. So there's a hold button and then a release. And yeah, I can hear it. You won't be able to hear it, but you can hear the air release. This goes down. Yeah, and then you get up, walk around, and it should continue to feel good during traction as well as afterwards for the rest of the day. If it response is good after one treatment of 5 minutes, then we'll go up to 10 minutes. See how it goes. And then the next day, maybe 15, 20 minutes is the most I've ever gone, but usually 10 to 15. And you can do this throughout the day, 2 to 3 times. I've had patients so happy with it, they buy them because it works, eliminating the need for surgery.
It's a neat little unit.
It is.
I
It is.
was very impressed with it. There are very inexpensive units over the door,
Right,
hanging
yeah.
ones, and they're fine too. We
Yep.
have no problem with whatever you want to try, or you can try the ones that don't cost anything at all. Use the towel.
Right,
And
exactly.
that's
And
fine.
again, I would never purchase one of these if laying down and a towel roll traction like we previously demonstrated. If that doesn't work, you only do that if that works really good and you know the traction is successful.
Sounds good.
All right. Wow.
All
Very
right,
good.
Brad and I can fix just about anything
Except for,
a broken heart.
there you go. Good luck.
Yeah, but we're working on it.
Be careful.